Hello, I'm Dr. Philippa Gardner, a clinical psychologist and the clinical lead of the Oldham Early Attachment Service. For this year's Infant Mental Health Awareness Week, the theme is trauma and understanding trauma in babies. This can be a really difficult thing for adults, parents and families to think about when we think about the experiences of trauma for infants and little ones in your lives. So what is trauma? When we're thinking about trauma, similar to adults, it's often for babies about an experience that they might have had that has left them feeling distressed, anxious, and we know that what can often happen is it has an impact on the developing brain. There's often a misconception that because babies are young, that somehow they won't recall or remember or won't be affected by traumatic events. And although in some part this is true, because the baby's ability to cognitively recall a traumatic event might not be possible. What babies are doing is that they are learning moment by moment each day from the environment around them. So if they experience trauma, maybe through a traumatic birth delivery or a traumatic experience within the relationships they have in their life, often what we call relational trauma, then we know that that can have long-lasting impacts on the baby in terms of their mental health and their emotional well-being, as well as their brain development. So if we think about trauma, what might we see in infants? And again, this can be really difficult to pick up, and it can also really be difficult to think about. One of the clear signs can often be that the baby, if we're observing them, can often be in a state of frozen watchfulness. So that might be that they are quite hypervigilant of what's going on around them, and that is because they're trying to anticipate what might be happening. It might also be a case where babies are avoiding eye contact with others. It might be that they avoid eye contact with certain people, or it might be everybody. And then there are other times where we are really worried, is when babies might even appear a bit shut down and shut off, as if they're not quite present or not quite there, and it's difficult to connect with them. These all might be signs of a traumatised infant. If you are worried about a baby, whether or not they've experienced trauma, or you're worried about what might be going on between you and your baby, then you can receive support and help through your health visitors, your GPs, your midwives, and they can also refer you on to the Oldham Early Attachment Service.